to say it's Sarah's birthday today, so happy birthday, Sarah. And I hope that everybody looks as though spring is here, Easter was last week, and we're really enjoying ourselves, and I'm ready for the sunshine here with my sunglasses. So for those of you that don't know who I am, I'm Susan Collini, and to my right, your left, is Ronnie. Ronnie is one of our medical assistants, is our technical director here. And to my left, your right, this is Ashley. Ashley is one of our estheticians who will be talking today about our great topic. Then we have Marley, our physician assistant, and we have Sarah, our age of innocence manager and our social media director. So, and I'm in the sunglasses not because I'm trying to get into spring, although you would think that, but I did have some eye surgery 2 weeks ago, so I'm still in the recovery mode, and these lights are a little bit bright for me, so I have to be incognito here with my shades. So I can close my eyes and nobody will ever realize that my eyes are closed. But today's topic, we have a great topic going on, and do you have our guest on our phone?
Yes, I have her number pulled up.
So I just want you to open up the mic and then we'll introduce her soon, but we'll have a guest speaker here soon. But today's topic is about hair removal. And hair removal for anyone, whether you're a man or a woman, could be problematic. So, I mean, some of us just decide it's just easier to have semi-permanent hair removal done just because it's nice. And some people really need it because of medical condition or other situations going. So Derek, who you usually see here, who's our laser director, should be up momentarily. He is finishing up with a client, but I want to talk about a couple of different ways in which to remove hair in this business. So most people are familiar with electrolysis or laser hair removal, and at this center we have always performed laser hair removal. But we're very, very excited because very shortly, as of May 15th, we will be offering electrolysis as part of our package to all of our customers, which really does complete the whole circle of hair removal for those clients who laser is not in their best interest or an option, as you well say. So Ashley, at this point, I'm going to speak to you first because you do hair removal laser down in the Collini Laser Clinic, and can you tell us a little bit about the process and why we do some of the things that we do?
Sure. So basically, a laser hair removal, the device we use is called a Vectus laser, and a few candidates. So if you are somebody who doesn't like to deal with dark, unruly, coarse hair, this is perfect for you. So basically, just a few things. If you do have lighter hair, like blonde hair, red hair, gray hairs, that's where the electrolysis will come more into play because laser hair removal picks up pigment in the skin and then in the hair follicle. So clients who have like really pale skin and dark hair are like the perfect candidate. So what happens is basically you would come in, you can do anywhere on the body. You can do the bikini line's very popular. The face, anywhere like the upper lip, the chin, the back. Males do this too. They do a lot of the chest area, the back. You can do the legs. Even some people have little like weird spots like their fingers or their toes. We could definitely zap those little stubborn hairs there as well. One thing to keep in mind is when you are coming in for the hair removal, you want to just shave the night before because you don't want all of your hair to be right there because it's going to be harder to get intact with the actual hair follicle. And what's going to happen is the light, when we shoot the laser, it will kind of imprint it on your skin and it will just not look really pretty and it's not going to work as well because we need to get a nice clean direct cut to the hair. You also don't want to tweeze or wax in between or pluck. Basically because you want that hair follicle intact. That's how this is going to work. And if you are actually waxing or plucking that hair follicle out, you're not going to have any bulb to destroy. So in turn, you're not really going to get a good result. And you want to make sure that you're just, like I said, shaving in between your treatments. And also too, one thing to keep in mind is when you do the hair removal, you're going to have to do for the face, it's anywhere from 4 to 6 weeks in between treatments, and you need about 6 6 treatments that we recommend in the package. That's just what works the best. And as well for anything from the neck down, because you have fewer sebaceous glands, you're going to want to do anywhere from about 8 weeks we usually recommend for between like the legs, the bikini, and it's a very, I mean, I tried a little spot on my bikini as well. I only had one treatment, but it definitely, like, you could see a difference. Like, even after one, we noticed the hair follicles a little bit slower growing, a little more sparse. And then we do, I mean, some people, depending on how your genetics are, some people are completely good after the 6 treatments. Other people might need a little touch-up. You might have, like, one little stubborn hair that just doesn't want to go away. We can also tackle that a little bit stronger as well. So everybody's different, and then we also deal with a lot of polycystic ovarian patients as well. So women who have like that hormone issue where you kind of get a little bit of the hair growing around like the jawline, you know, the lips. So we do treat that as well. And
So thanks, Ashley. That was pretty thorough about our hair removal laser. But one thing I want to mention, I'm going to backpedal a little bit. So why would you want to choose a laser? First of all, the way the laser works, and the way it works the best, is that we know that we like fair skin, dark hair. And the reason being is that the light from the laser, once you fire that laser, will follow the hair into the bulb, and that's where it destroys it. And it is attracted to, opposites attract, so light skin, dark hair. And you think it might work, dark skin, white hair, it doesn't work that way. So this is one of the reasons that, first of all, you need multiple treatments, and not everyone is a candidate for laser hair removal. So the reason that you need multiple treatments is that the hair is in multiple stages of growth. We have 3 phases of growth, and I'm going to let Marley talk about that in just a minute, but those 3 phases of growth come out at different times. And so that's one of the reasons we schedule you at different increments, so that hopefully each time that you have a treatment, you're getting another collection of hair that's in a phase that it can be treated. So that's one of the reasons that, you know, you do have to go through multiple treatments. People ask all the time whether laser hair removal is permanent. I like to say it's permanent long term. So I know that seems a little frustrating, but I can honestly tell you from candidates that maybe we've done 10 years ago, 12 years ago, they might start to have a little bit of breakthrough hair growth, but it's always very fine. It's never like it was, and you might need a follow-up treatment years down the road once you have, you know, your initial treatments done. And we do recommend that most areas do require about 6 treatments and then some. So that's the starting point of any type of treatment process, is that 6 treatment phase. So at this point, I'm going to hand it over to Marley, because we're going to talk a little bit about the 3 phases of growth, and then we're going to talk about those patients that don't fall into the category of white skin, dark hair.
Yeah, so the 3 phases of hair growth, the anagen, catagen, and telogen phases. The anagen is the hair growth phase, so that's when your hair is actively growing. So like we mentioned, you do need multiple treatments because we want to affect that hair follicle and target it when it's in the growth phase, so that we can stop it from growing. So we can permanently or semi-permanently stop that. So that is, so at any given time, all the hairs anywhere on your body, they're all in different phases. It's not like all my hair is in the anagen phase at one time and then the telogen phase. They're all going through different phases scattered. So that's why you need the multiple treatments to really get all of the hair.
That's great, thanks Marley. And Karen popped in while we were starting our conversation, and Karen is one of our nurses and also an esthetician, and does hair removal laser and has performed it for many years for us. Karen, would you like to add anything that we may or may not have mentioned as a group?
Well, our laser hair removal is really dramatic. We have that sapphire optic lens that just targets that chromophobe and finds the melanin and goes in. One thing I was reading about the anagen phase, that is the only phase when your hair is attached to the bulb. So it's the only time you can ever get the direct hit from the outside hair to the root. So that's one of the things that I read about that I hadn't really known. I knew anagen phase, but I wasn't sure the science behind it. The other thing, and I don't know if you mentioned it, we do a good skin analysis before we determine that you're a candidate for laser hair removal. And they're finding out that pregnancy isn't really a deterrent, but the hormonal changes, you might not get a good result. So they recommend that you probably wait. We make sure that your skin is in good shape, that there's not any pigmented lesions that might be malignant or iffy. And so those are the things that we want to make sure that we're assessing before we actually put the laser to you. I know Ashley probably mentioned you wear eyeglasses to prevent watching the laser beam because it's damaging to the eye even if you close your eye. And they want more direct safety protection. And then I don't know if we discussed the aftercare, but I keep telling people that you have to stay out of the sun, right after. And they recommend you don't go into hot tubs or swimming pools or anything because your skin is very, very sensitive. One of my patients had a reaction to any kind of heat. She would break out in a heat rash. And so I assessed her the next day, and sure enough, the laser is heat, and she had the heat rash. And that disappears within 24 to 48 hours. But I think if we determine in our interview with them that they do have sensitivity to heat, then we have to warn them a little bit about the laser. Possibly we'll give them a little rash.
Super, more good information. Ronnie, I don't know if you had anything to add at all, because we've been, but I know Ronnie would have something to
Yeah,
say.
I actually had laser hair removal on my neck. I had 3 treatments, and my hair was as thick on right up here on my beard as on my neck, and it really worked. It really cut down on that everyday shaving, making sure it was down. I will say I'm a little bit younger, so I have seen those hair follicles kind of regroup and get themselves back together a little bit, but definitely something I would do again. Cuts down on my morning routine a little bit and keeps my skin a little bit smoother.
I think that you mentioned because the thickness of your beard
Yes.
is very problematic for a lot of men because you get ingrown hairs,
Exactly.
you get some follicular,
Just
flare up.
irritation.
Right,
Yeah.
and those are reduced whether it's the neck or it's the bikini line, anywhere that we're shaving regularly can be a problem,
Yes.
and that's why people are electing to do this. And the one thing is, even with just the first 3 treatments of laser, even though we say 6 or more, you're still going to
Yes.
reduce that number, and it becomes a lot more like downy soft.
Yes.
It's
A lot
not
more
as
manageable.
bristly and wiry, so it's much easier to shave in
Yes.
the duration. So you're still getting an effect, like even if you're thinking now that we're in April, and oh my gosh, we talked about the sun, but we're getting closer to summer. Like this is the perfect time to start jumping
Yes.
on board and at least get 1 or 2 treatments in before summer. It doesn't hurt you if we have to push off that phase 3 or 4 into the fall or break it up a little bit. You're still going to get benefits that some hair is always in that anagen phase of treatment. And so that's the thing that we try to always recognize with our patients. And I think that all of us have done really great here. So at this point, we have a very special guest that hopefully we're going to turn up the volume because she couldn't be here at 1 o'clock today. But we have a new team member coming to the Cleaning Laser Clinic and Age of Innocence, and her name is Suzanne Mattern. And she is local to the area, but has been training with the best people in Florida for electrolysis. And electrolysis is new to us. We have not had someone qualified to do it, but we think it's a very, very important addition to our arsenal of things that we help bring to you because it treats those customers, those patients, those problems with another form of, with another service that we can help everybody along the spectrum. So I'm going to turn this over to Suzanne, and hopefully you'll be able to hear her. Welcome, Suzanne. Oh, wait, we're just calling her. Sorry, I thought we had her on an open mic here. So, there we go. Suzanne, I don't know if we can hear you. Can you shout?
Hey, I can hear you guys. Can you hear me?
We hear you, but I don't know if our camera is hearing us.
Can I bring your phone up there?
We're going to bring the phone right up to, this is our technical
This is how we do
difficulty
it.
because this is our Facebook Live. So we're going to bring it right up to, Suzanne, I'm looking at you far away at the camera, but you are talking into the camera. So I'm just welcoming you to all of our viewers. We talked about laser hair removal, but we also talked about the addition of bringing electrolysis to our customers for those customers that really may not be a candidate, or they may need a combination of therapies. I mean, that's another process that we haven't talked about. Some patients might need both.
Absolutely. And hey, everybody. Can you hear me okay?
Yes.
Great. Perfect. You guys did a great job explaining the laser hair removal, and I'm super excited to be able to offer the service of electrolysis at Age of Innocence and the Cleaning Laser Clinic. It's super exciting to add that to the long list of menu items that are offered, so it's super exciting. But yeah, electrolysis. So it's a great form. So it's actually the only form of permanent hair removal that's actually like an FDA approved for permanent hair removal. And where this comes into play, which is really beneficial, is for people who have gray hair, or who have light hair, or who have darker skin and darker hair. So as Ashley said earlier, where the ideal client for laser is that light skin, dark hair because of the contrast, this electrolysis can be used on any hair type and any skin type. So oftentimes if someone is not a great candidate for laser, electrolysis works great. And they also can work, they work together really well. So we're super lucky to be able to offer both of them now.
Well, I think that's great, Suzanne. We're really excited for you to join the team. And again, there are two different processes, two different services. And I think that I don't have anything else to add. Does anybody else in the team have anything else to add before we sign off for today? Everybody good?
I can tell a little bit about electrolysis.
Oh, that would be great, Suzanne. Go ahead.
Sure. So, electrolysis has been around forever, since like 1875, but it's come so far in the recent years. Because sometimes when you think of electrolysis, you think of way back when it was like slow torture, and we actually at AOI have the most up-to-date, state-of-the-art machine. So the comfort level has increased dramatically from what it used to be. So it's not painless, but it is so much more comfortable than it used to be. So for people who might have heard the word electrolysis and think that it might be kind of scary or really painful, I want to reassure that things have come a long way, and it's a really effective treatment. And again, with the technology, the pain and the aftercare, it's just improved dramatically. So there's nothing to fear.
Well, that's always a good thing, because I think that's one of the things we probably heard about with laser hair removal, that people wanted that option. It seemed quicker or whatever, but then they might be disappointed because after consultation they find out that they may or may not be a candidate. So we're just really excited to again bring you the latest equipment, the latest service provider, because our service providers are all, we have tremendous education constantly for not only our own benefit, but definitely for our clients, and we want to assure you that we're bringing you the very best that we can. And for those of you that want to jump on board with hair removal before summer starts, it's not too late to call us. Get in and let's see where we start, and hopefully you'll get to be hair-free for the summer, or at least partially hair-free. And I think that's it for today. And thanks for the roundtable to all the girls. The guys left us today, so we're kind of lopsided here. But I want to let you know that our next roundtable is always the first Wednesday of the month. So we will see you in May. I think it's Cinco de Mayo, so we can celebrate Cinco de Mayo the next time we see you. And it is about Skin Cancer Awareness Month in May. So we will be talking about obviously skin cancer awareness and sunscreens, the importance of all the things that we offer to help you help yourself stay healthy in the sun and enjoy the sun. And we're looking forward to summer. And a last minute happy birthday again to Sarah over there. And we won't let you know how old Sarah is, but she's celebrating her birthday today. So happy birthday, Sarah. Bye everyone, till next month.
Bye.